Why did we do this video?
I like the feeling that my parents respect my choices.
Don't be afraid to ask for help.
Feeling when I'm an adult, I can be independent.
I thought it would help people who had problems like I had.
The reason I do this video is because I get you. You're not alone.
I'm Doug Wolf. I'm employed by the Iowa Department of Human Services. I'm a program manager overseeing statewide programs for youth in foster care and youth transitioning to adulthood. Over the last 6 or 8 years that I've been working for the Department of Human Services, I've noticed that there's increasingly been young people involved in improving the child welfare system and active in their own case plans. And that's been tremendously successful in terms of improving the child welfare system and improving the lives of children and families. And that's really been great to be part of. So when the federal government recently asked states to increase their efforts or improve their efforts in assessing the mental health needs of children in foster care, we jumped at the opportunity to involve young people in looking at this with us. And of course, this presentation of young people is really all about the young people speaking to other youth and adults that are involved in their lives through the child welfare system to find ways to advocate for and to help young people to advocate for themselves and to encourage the system to do a better job of inviting young people to advocate for their own mental health needs, their own medical needs, and that kind of thing.
My name is Nayeli Torres, and I'm 18 years old. And today I want to talk about my story and the fact that how I think that people should make their choices about taking medication in the foster care system. When I was 8 years old, I was put in a foster home with my brother, and I remember it was very scary, and I didn't know anyone. I didn't know how anything was, and I remember that I was told that I was having to go see someone, and I was not ready to see or talk to anyone. They evaluated me due to being abused as a young child. When you are abused, you get evaluated right away, so it's not something that they want to see your behavior for a while. They want to see and help you as much as they can. I know that today it's been a lot easier to talk to people, and I am more willing to talk to people about my problems and the things that have happened to me. I've grown a lot, and I remember that, when they were trying to put me on medication and trying to make all these changes and the move and everything, it was just too overwhelming, and I just couldn't take it. I refused a lot. I was pretty bad at first, and I pushed people away. I hurt them. I put my wall up. I did everything I can to destroy everything around me. After a few foster homes, I was put into residential treatment and was forced to take medication. And for a long time, I didn't believe in it. I lied and said everything was fine, and made this mask that I didn't need anyone but myself and my family. And for a while after that, I finally started to realize that medication was helping me, and was helping me with my moods, my depression, my anxiety, all of the problems I was having. I remember going to school and also taking medication and having to leave the classroom to take medication, and I just wasn't ready for that. I didn't like leaving my friends and having to tell my friends what I had to do, or they always asked me why I was late or things like that, and it just made me really uncomfortable because to me I felt unnormal. And I later on realized that it is normal. Some people do need it, some people do rely on that stuff, and I do agree that some people need it. And as today, I made the decision that I have joined the military, and due to that I have stopped my medication, but I do take PRNs, which is a medication only when I need it, such as my anxiety. I do believe that really helps me a lot, and I do believe that it's gotten me really far in life. And today I have been very thankful for my support system to help me make the decisions and support the decisions that I've made along the way.
If you choose to get off your medication, there are other things to help you feel better, such as joining things. I joined the Army.
I like playing sports.
I like painting.
I like working outside.
I like listening to music. I like to play football.
I like to cheer.
I came to the system when I was 8 with my 2 little sisters. The first house I went to wasn't really that well. Instead of hitting the kids there, they'd hit their own kids. For the foster kids, or they called us the fake kids. For what they did, they'd hit their own kids. And I guess I was just kind of anxious or nervous to see if they were going to actually hit one of us. And so I turned them in about two months later, and I got out of them by my 3rd month. And then I went to my aunt's house with my uncle, and then we started finding out that they were doing drugs, and so then we had to be moved again. I just thought, wow, every house is the same, and then when I started getting to better houses, like my last 3 houses were, one was in Bedford, and I just kind of liked that because we were able to do a lot of things. So I had a foster parent who thought my behaviors were out of control, and they had me assessed 3 different times. The first and second time they didn't see anything, and then the 3rd time they finally diagnosed me with ADD, ODD, and ADHD, which was 4 different meds I had to take. I did see some therapists. That sounded weird. And I guess they just kind of didn't see that problem, or they didn't really help me because I just kind of put on a mask and said, yeah, I'm doing better, I'm doing better, I'm doing better. And I just kind of, I guess what they would call it, graduated from their therapy. But the mom I live with now, which was my adoptive mom, has seen it more and more, and now I have 2 therapists, which helped me a lot. And I'm not trying to do the masks or anything, because I know I need this help.
How long will I have to take my medication?
How will I know if it's working?
When will it start working?
How common is it for people my age to be taking medications?
How experienced are you with this medication? How often do you explain it?
How will this affect my life?
I came into the system in 2006, shortly after my mom had passed away and my dad had taken off. I was diagnosed later that year with post-traumatic stress disorder, manic depressed, and slight mood changes, not bipolar, but mood changes. They diagnosed me because I had went in to see a therapist shortly after my mom died to help with grief counseling, and they noticed that I was placing a lot of blame on myself for her passing, and there was also a family history of mental disorders, my dad being bipolar, my mom having depression. So they wanted to do tests on me to see if I was gonna follow in the same footsteps. They also diagnosed me because I had told my therapist that I would have dreams probably 3 or 4 times a week of finding my mom and her asking me why I didn't help her. So they diagnosed me and they put me on 2 different antidepressants and a sleeping medication to help sedate me better when I was asleep. Yeah, I tried 3 different medications before they found one that stabilized me enough to where I wouldn't have as many episodes. I'm still on them. They don't want me to get off of them because they don't know if I'll be stable enough without them to function and not have recurring episodes. So I go to therapy twice a week. Yeah, it seems to help me because the therapist I see, he's been with me since right after my mom died, so he knows when I go through my episodes how to talk me down and how to get me to realize that it was not my fault that she died, that if I was there, I may not have been even able to help her or call an ambulance in time, or I think he's one of the only people that can get me to see that way.
How do you decide to go to therapy? How do you decide when it's time for you to move from just talking to friends, to really needing somebody that you can connect with on a different level, that doesn't have any real true responsibilities as a parent or as a friend. Somebody who can be neutral and give you and provide you that kind of insight. When does that happen? I think it happens when you begin to feel like there are secrets that are holding you back, things that have hurt you, things that have been hard, that you really don't feel like you could talk to your parents about, and you really don't feel like you could talk to friends about. That's when I think you need somebody like me, a social worker, clinical social worker, a licensed mental health practitioner, someone who works on developing strategies to feel better about themselves.
Have you been feeling depressed, hopeless, worthless, and are unable to take care of yourself? Seek for help. Don't deal with it by yourself.
Actually, my doctor kind of noticed me that I'm having a lot of anger stuff. So they pretty much put me on a lot of medications first, just to calm me down before we talk more to my doctor. Because if I don't take my medication, I'll start having more problems and focusing on I'm not focusing on other people. So if I don't take my medication, it's gonna get worse each day. Cause at home, if I don't talk about my feelings, it'll build up inside my body of it'll build up anger, will build up, and then I'll have drama with my mom and dad, big fights, pulling hair, for example, or throwing chairs, something that can distract everything. So that's why I'm taking my medication, is because so I can be calm and not get angry, actually. I've been having a lot of testing going on just to see if there's more stuff, and there is actually more stuff that I'm having trouble with, focusing, behavior. For testing, you really have to know it. It's like circling a bunch of questions, and it'll tell you what questions you need to have, and then you'll circle what your correct answer is. This, he or she will mention it some shapes and stuff to see if you're focusing on what you're doing instead of spacing out. I've been through a lot of testing, actually, but it's kind of good that they were doing testing and assessment stuff, so they know what I'm capable of doing.
You know, when you find yourself in a situation where you've moved into foster care or a residential program, whatever that might be, there are then those times when people are going to want to figure out how things are being handled by you. And the best way that they can do that is through assessments. So you might go to a psychiatrist, you might go to a psychologist, you might go to a clinical social worker, you might go to a mental health counselor, a nurse practitioner. All of those people are part of a team that's trying to help you move forward in your life. And so please don't think of them as enemies, because all they're trying to do is help you move to the best place that you can be. Psychological testing, for instance, because we want to figure out how you learn, because we all learn differently. And for some of us, like for me, for instance, I have ADHD. I've had it all my life. When I was a little boy, they told me that I had minimal brain dysfunction. That was the first name for ADHD. But what we really need to figure out is how my executive functioning works in my brain. We had to figure out whether or not I had trouble moving stuff from what's called short-term memory to long-term memory. The only way we could really figure that out is for me to take an IQ test. An IQ test gives us a whole bunch of kind of wonderful information about how we learn, not just what your IQ is, okay? Because those are important components to know. And then, if there's been some type of trauma, if there's been other kinds of things, then there are different types of assessments that can help us understand what is emotionally going on for you, so we can better help you move forward and get better.
I had been in foster care since before I could remember, so I had ended up starting pretty early, and I had no idea what was going on. Then when I got around 4, I realized I was seeing my mom very often. So then I assumed, then I was told there's trouble, like problems going on within my family. After a couple of foster cares, I ended up going one with a family that really was concerned. They saw that I wasn't getting along with children my age at school, wasn't having many very friends that would stay, hang out with me at all. So then they started taking me to a therapist, and he decided that maybe medications could help because I was still blaming myself. So then we started talking about what first stop medications we could use to help with my anger and my self-blame. And they try to explain, each time we try a new med, they would explain to me simply what it could help me do, and that way I would know if something changed, I would know what was causing it. I had some minor side effects from some of the meds, like I would be drowsy throughout the school day, so they'd have me visit the nurse to give me a wake-up med during lunch so I could wake myself back up. Then a couple of times it would make me a little more grouchy if I either forgot or didn't take them for a while. Over time, they did give me some diagnoses, like I was given ADHD because I was so hyper and had a lot of this energy as a child, and they started giving me, they started giving me my meds because my teacher started complaining to my parents that I wouldn't stay in my seat, that I was jumping all over. So they started giving me medications for that, and then when I was able to calm it down myself, they took me off those meds. I'd say it does help me a lot, feel better. Usually it just lets me open my mind, so if I feel I'm getting upset, I'm not so blinded by my anger that I could think before I get too angry and decide what my next step will be before I freak out.
There can be a lot of different type of people on your side.
Your caseworker.
Parent.
Your siblings.
Your friend.
Your guardian ad litem.
Your doctor.
Your therapist.
You're not alone.
So one of the things that I think is important to understand is the roles of the people that are in your team. A lot of people come into my office and they want to call me a doctor. I'm not a doctor. I'm a clinical social worker. That's what I've been trained. I've been trained to do therapy. That's what I do. I don't provide medication management. I am part of this team. And so let me tell you a little bit about this team. A psychiatrist is a physician, either a DO or an MD, who has then gone on to specialize in the process of psychology, understanding the psychological process of the brain and how medications can affect that brain. And so they've gotten specific training around how to help different types of medications and understand different types of medications that can help you. In that category is also licensed mental health nurse practitioners who have also been trained to work on providing medication management. They aren't doctors typically, although they could be, but most are not. We also have PAs, physician's assistants, who are assisting the psychiatrist around this whole process. Then of course you have doctors who are family practitioners. Even though they aren't psychiatrists, they can provide you medication management. But it's again working with the team. The next level of individuals are psychologists. Psychologists, typically PhD psychologists, who do therapy, but they also do a lot of testing. That's who you would go to get those kinds of tests around IQ tests or personality tests, those types of things. And then we have licensed independent social workers in the state of Iowa. I'm one. Licensed mental health practitioners, mental health counselors. They are master's level individuals who do therapy. Licensed marriage and family therapists, master's level people who do therapy. Okay, all of those people are doing that type of insight-oriented therapy. You might see them once a week, twice a week, 3 times a week, depending on what the team thinks needs to happen. And then you have individuals who do, for instance, what's called BHIS services. They're bachelor's level clinicians who come in and do counseling as opposed to therapy. What's the difference between therapy and counseling? Well, the big difference is that counseling is coming in and doing educational work with you and your family, how to treat each other in appropriate ways. Therapy is when you come in and this guy, like me, talks to you about what might be going on in your brain and then talking to you about how to work through those pains and hurts and angers, as opposed to teaching you things that you might want to use in your family.
Well, I was 4 years old when I went into foster care, and I first went to this family that I thought that I was going to stay with forever, because that's what they were saying, that they wanted to adopt me and all that. And then they asked me if I wanted adopted, and for some reason I said no. I don't really know why. I just thought that it wasn't the family for me, I guess. And then I went to a different foster family, and I ended up being split from my biological sister and brother. And then that family didn't really turn out too well, because when we got joined together, we were still living together, and I was always abused at that family since I was the second youngest. And I remember getting like pulled down the stairs by my hair and just getting like slapped around. And I was always the child that was blamed the most, and I was a kid that was crazy, I guess, in their words. And I couldn't go out and hang out with my friends, and I couldn't do any sports in the schools, and so I felt like a kid that wasn't normal. I went and talked to my parents, and they were like, would you want to keep taking meds this year or give it a break and try and then see how the summer will turn out? And I was like, yeah, I'd like to see how it would go. And we talked to the doctor, and they're like, yeah, I think that'd be a good idea to see how far she's come with her accomplishments and see if she will like increase with that or decrease. And well, I haven't been doing so well, but I'm still trying like really hard because I don't want to go back on my meds for some reason. But I would like to go back on them only for school, like not for weekends or anything like that. But yeah, it was my choice and my parents to go off meds, and I thought it was a good idea when I first made that choice.
If you're thinking about hurting yourself,
or maybe hurting someone else,
then seek professional help.
Medication is nothing that should be thought of lightly. Your physician prescribes medication for you, and he is doing so with his best clinical judgment of what he knows, which means that the medication that he's recommending for you is for you. It's not for your friend or your other friends. Even though some of your friends may ask for some of those medications, because some of them might be what are called psychostimulants. Those medications that if people take a lot of, they just feel really, really high, for instance. But these medications are specifically designed for you in terms of its dosaging. And so it's very important for you not to provide other people with your medication, even if they say, well, I'm feeling really anxious. Do you have anything for I know you go see so-and-so for your anxiety. Could I try one of your pills? Don't do that. It's not good. You could get into a bunch of trouble. They could get into a bunch of trouble. And who needs trouble? Don't stop your medications. Talk to your psychiatrist or your nurse practitioner or your doctor, whoever's prescribing the medication, because it's again about partnering with them. We have too many people who stop their medication because they're feeling better, and then what happens is that they say, well, I've gone 2 weeks now and I'm feeling much better, so why do I need my medication? When the reality is, the medication is still working in your body. Some medications have what is called a half-life, and so they stay in your body for a while. So when you think you're off the medicine because you haven't taken it for 2 weeks, you're still really on your medication. So please be careful about that. It's just not a good idea to spread your medicine around because maybe it works for you, it may not work for the other person.
When young people and adults are working side by side, the success rate is exponential. It works much better to have a young person involved in their own planning, in their own team, and working with adults to be successful. I want all children in the foster care system and the adults that are taking care of them to know that if you're in the foster care system, you have Medicaid. Medicaid is medical coverage, and it's really fantastic coverage to help with the assessment of and provision of whatever kind of treatment that a young person would need for mental health issues or any kind of medical problem at all. And it's coverage that is provided to all children in foster care, and it's also coverage that is provided to those youth who transition from foster care to adulthood. So if a child is in a foster care placement that is paid for by the state when they reach the age of 18, they can get Medicaid coverage till the age of 21. One of the things that is a little technical piece that I want you to be aware of is that much of the paperwork that is required for this, it's a federal program, federal Medicaid for children in foster care. Much of the paperwork is completed by case managers or juvenile court officers. However, those youth who transition from foster care to adulthood, because they no longer have a caseworker at that point, between the ages of 18 and 21, the youth is responsible to complete the paperwork. And as you might imagine, paperwork that is sent to a youth's apartment or their dorm room that is very bureaucratic, it's very businesslike, they oftentimes don't return that paperwork, and it causes their Medicaid coverage to stop. We can support those young people by teaching them about this before they leave the foster care system, so when paperwork comes that they don't understand, they'll go to their support people and their advocates, whether those were people that they worked with when they were in the system or people that they're working with in Iowa's aftercare system or some other resource. They'll ask them how they can get the paperwork filled out or in fact if they need to. And AMP, the Iowa Foster Care Youth Council, is a fantastic place for children in foster care and young adults to go to find out, how can I get to see a doctor? How can I get the health care coverage I need? Is there some way that the state can provide this for me, or are there other avenues where I can get health care coverage? Since the Iowa Foster Care Youth Council, formerly Elevate, now known as AMP, Achieving Maximum Potential, has been involved from the State House, so the Iowa legislature has heard from young people, foster care providers, families, judges, DHS workers, and all sorts of child welfare professionals and professionals across all of our systems. Since they've been hearing from these young people, it's really energized the system, and it's really encouraged people to stop whenever they're doing anything that affects the lives of children and families, to stop and say, have we asked children what they think about it? Have we asked mom and dads what they think about it? Have we asked family members and friends in the community what they think about this situation? And when we're talking about the mental health needs of children, there's nothing more important than really engaging the family and the children in the conversation about what works best for you. How do you feel? How does this work for you? And what is this going to lead to? For all of our children, we want them to grow up successfully. We want them to age out, whether they're in the foster care system or whether they're in our own homes. We want them to leave and enter adulthood and be successful.